Fetal adiposity facts. Most of the fetal fat deposition happens in third trimester. There are certain maternal risk factors pertinent to fetal body composition, and these are gestational diabetes, gestational hypertension, preeclampsia, excessive weight gain during pregnancy, PCOS, family history of diabetes and hypertension. There are no paternal determinants of neonatal adiposity. Now we must understand certain growth facts in association with gestational diabetes. Intrauterine growth is the result of genetic potential, substrate availability, and endocrine regulation that will determine the growth trajectory during intrauterine life. Most fetal weight is gained during the second half of gestation when fetal growth is accompanied by a large and exponential deposition of fat tissue. Fetal fat mass growth seems to correlate strongly with the intrauterine environment, whereas fat-free mass, that is lean mass, which consists of muscle and bone, shows stronger relationship with genetic factors. Evaluation of the nutritional state in utero can be achieved by estimating fetal body composition. This might improve the prediction of specific perinatal risk in conditions of under and overgrowth of the fetus. Now, in gestational diabetes, there is an increased intrauterine growth and also increased fetal fat mass deposition, which result from the combined effects of increased nutrient availability and the permissive environment of fetal hyperinsulinemia. The abdominal circumference is traditionally considered the most sensitive and simple fetal parameter for the detection of intrauterine growth abnormalities. Fetuses of gestational diabetes show greater growth at the same gestational age in comparison to control pregnancies. The growth of these fetuses is greater for lean and fat non-traditional parameters as well, besides the traditional abdominal circumference. There is a significantly greater amount of total tissue mass and a higher fat mass over lean mass ratio, independent of gestational age, in these fetuses. Evaluation of growth curves of conventional and non-conventional fetal biometric indicators of lean and fat mass in the second half of gestation in diabetes highlights the different pattern of growth in these fetuses in terms of body composition. Estimated fetal adiposity was seen to be a better predictor of newborn adiposity than fetal weight by conventional biometry. Neonatal fat mass, as estimated by skin fold thickness measurement, is significantly higher in infants from women with diabetes mellitus and gestational diabetes.